Good afternoon. Good to see everyone again. Ben Leonard, congressional healthcare reporter here at Politico, and I focus on Congress and co-author our Pulse newsletter. Really excited to be sitting down with Representative Brad Wenstrup from Ohio, and thanks so much for coming here today.
Yeah, my pleasure.
We got a lot to dig into. We just heard from Congresswoman Kelly about the future of doctor pay under Medicare, talked about weight loss drugs and other innovation going on in the sector. You're a podiatrist and chair the COVID Select Subcommittee, Doctors Caucus co-chair. So we got a lot to dig into, from the investigations in the pandemic, doctor pay, so much more. So, just want to jump right in on the weight loss drug situation. What do you? I know you support Medicare being able to cover these drugs. How do you? But they're could be pretty pricey. How do you hope to pay for that?
Well, one of the things that we have discovered, and we've had Congressional Budget Office representatives come in front of the Doctors Caucus, and what we've discovered is they don't really know how to evaluate savings that comes from actual treatment, and they don't know how to necessarily put a value to the healthy human life compared to the one that's ill. So when you look at the cost of a medication, I understand it's important to do that, but at the same time, it's also important to say, but here's what we're trying to achieve. And in Washington, for example, pretty much when you talk about health care, it immediately goes to Medicare, Medicaid, Affordable Care Act, Blue Cross Blue Shield. You just start talking about insurance plans, and not so much about what can we do to make America the healthiest nation on the planet. What's the prescription for a healthy nation? What are some of the things we can do? And to me, this is one of those examples. So the bill that we have to have Medicare pay for this bill, and others follow what Medicare does. Let's be realistic. You pay for this type of medication, but it isn't just that. What we have into the bill is allowing a doctor to write a prescription to then get coverage for someone to see a nutritionist or a dietitian, because it's more comprehensive than just take the bill. And when you look at this one in particular, what are you preventing? You're preventing strokes, you're preventing cardiac disease, you're preventing orthopedic problems, you're preventing hypertension, you're preventing diabetes in so many cases. Not 100%, but you greatly reduce them. And you have to look at all the costs of the other things that come with obesity. And I just think that the more we address that, the more we're going to be successful on having a healthy nation, a healthy workforce. And that's just one example of what we're trying to do. I know it was mentioned earlier about having a cure for hepatitis C. And immediately the discussion here goes to the cost. I get that. How are we going to pay for it? But how can you not look at the return on investment of that? Because a cure for hepatitis C costs a whole lot less than a liver transplant and repeated hospitalizations and things like that. So if we can somehow put that into the scoring, it makes a difference. But there's also ways that you can look to cut back and get things paid for with maybe taking some savings from other programs. This is a big government. There's a lot of places you can look.
Do you think Congress would have to mandate some sort of change to CBO's scoring method to get this across the finish line?
Well, we're having conversations with them. I mean, when we met with them, they said, we just don't know how to do it. And so we're meeting with them, trying to get something. It's not going to be 100%, but you can look at data. Let's just take the example of hepatitis C. You can look at data and say, before we had this cure, how many liver transplants did we do in the last 10 years because of hepatitis C, and what was the cost? And then you can say, well, over 10 years, we may reduce that cost down to nothing. So I think there's ways of doing it. We sometimes have to look back on what we are spending for some of the other unintentional consequences that come from having one disease that leads to another.
On the doctor pay issue, I was just talking about this with Representative Kelly. It's every year it seems like it's a predictable cycle of the cuts and then having to have a fix. Do you think that this is the year Congress finally gets the doc pay issue dealt with for good? And what do you think should be done?
I don't think it's dealt with for good, because even what's being negotiated right now and may go forward is just having less of a cut. But the cuts have been tremendous over the years, up to 26%. You know, I started with a practice of just 2 employees, and if someone was sick, my mom came in and brought patients back. I then joined a large orthopedic group. There are costs involved to having your practice, and so you rely on reimbursement. And if it's not there, it's very hard for people to keep their doors open, especially in rural areas. And over the years, the administrative costs of just your own practice have gone up so much that it makes it more and more difficult. And even if you're employed by a hospital, or the hospital has, 70% of the doctors who work at that hospital are employed at the hospital, it's going to be a big cut. It's very challenging, and it's been going on for some time. We need to solve this, because how can you do preventive medicine? How can you save money? How can you keep people healthy and save money if you don't have physicians practicing? And to that point too, a statistic I saw recently, or was told to me recently, and I don't know where it's coming from, but they said 60% of medical students today don't plan to practice clinically. How are we going to take care of people? I mean, this is a problem. So we have to do more things to have doctors going into medical school, or coming out of medical school wanting to take care of patients, rather than going into research and things like that. So pay matters, because if you can't keep your doors open, then you can't go do it. And it's challenging.
To move on to your work on the COVID committee, you've had a lot of investigation into COVID origins and handling of the pandemic. Do you think that we'll ever be able to definitively say, what caused the pandemic, and where are you leaning right now on that question?
Well, I think we can draw conclusions, and part of the job of the committee is to look at origins of COVID, but it's not just that. I consider this an after-action review. We have to look at everything that happened during the pandemic, how we responded as a government, how we responded scientifically, medically, and what are the lessons learned, and then sort of craft a path forward for the next pandemic. And you know what? You can't just prepare for the one we just had. You have to be prepared for any type of pandemic that may come along. Maybe the next one just affects kids. So how do we coordinate our agencies and all that? But you asked specifically about the origins. I can tell you from all I've seen, and I'll never be able to prove it because China is not cooperative at all, but there's more evidence to imply that it came out of a lab in Wuhan as opposed to coming from nature. If you look at the article that Dr. Fauci touted and said, it was called Proximal Origins, it was printed, and it said it came from nature. If you read it, there was a lot of assumptions in there rather than actual facts. And they're kind of contending that a bat from here somehow met up with a pangolin from here, and then somehow got their way to Wuhan with a new virus. I guess it's possible, but it doesn't seem likely, because these animals don't necessarily leave those regions. That's one thing. And then if you look at all the things that happened with China destroying their sequences of viruses that they had in the lab, people getting sick that worked at the lab before it became clear, China telling me that there's no way you should even be looking into this, that they've already settled it, that tells me something. We will never have it 100% because they won't cooperate, but when you see at the end of the day what we have compiled and the type of work that they were doing in their labs, people can draw their own conclusion. The key is, to me, going forward, is we have to acknowledge that it is humanly possible for scientists to create a virus and make it more infectious to human beings. They have the skills, they have the knowledge, they have the capability. And in my opinion, gain-of-function research doesn't need to be done. I know you were talking a little bit earlier about AI. If you want to talk about predictability of evolution of viruses, I think we can do a lot of that with AI. Don't need to do it in a lab.
So COVID has become this partisan issue and people are pretty dug in. Do you think that anything on your committee the work that your committee's done has helped with that? And I guess, a lot of people have pointed fingers at President Trump for, his handling of the pandemic. Do you think that he and his actions at all, impacted public trust? And
Well,
in that regard?
there's a lot of people that, depending upon how you're looking at it, the public trust in public health has diminished. I'll take it to some of the roots of things that we can do better. And something I even said when COVID was first started, I said it to Secretary Azar at the time. I said, no offense to you or others necessarily, but I think America needs to hear from the doctors that are treating COVID patients, not the politician and not the person in the lab, but somebody who's actually at bedside who can look out and speak to America and say, here's what we're seeing, folks. And it seems like if you have these other diseases, you're more likely to die. And it seems like if you're younger and you're healthy, you don't have a risk. I mean, early on, when this happened, I was on the phone. We were in lockdown. We're researching, trying to find out what we can do to treat patients. But during that process, we've discovered this article from 2015 where Ralph Baric in North Carolina and Zheng Liqi in Wuhan, China, have created a chimera or a new virus, a gain-of-function virus. So there's a lot of lessons learned, but I think messaging is one of the things that really ate away at public trust. And just give you an example, when someone come out and say, first of all, the vaccine, I gave people shots at home, and I got the vaccine, and I got COVID later. The only reason I knew I had COVID was because I couldn't smell garlic salt when I was cooking. So, we weren't looking at antibodies. We weren't having patients engage with doctors later on. That was a problem. But even still today on the committee, when I hear somebody come in and say, this vaccine is safe and effective, I said, you've got your parameter of what safe and effective means, but America hears 100% safe, 100% effective, and we knew from the trials that yes, the vaccine was very effective. A lot of lives were saved, hundreds of thousands of lives were saved. But at the same time, it's fair to tell people you can still get COVID even though you've been vaccinated. You're less likely to get sick. You should still take precautions. Those types of things. Messaging was never very, very clear to people. I sat with a group of people that were hesitant to get the vaccine, and when I explained to them, one, how the vaccine actually works and what it can do, and who's at risk, some said, well, I'm more inclined to want to get it now. But I was honest with people, and I said, but I don't know 5-10 years from now. So I was very much in favor of emergency use authorization for the people that were most vulnerable. And we knew what those comorbidities were pretty early on, and age was one of them. And so we went that way. But when we mandated it, that was the problem. See, America doesn't do well with because I told you so. People want to be educated, not indoctrinated. And so as far as lessons learned, I think those are huge lessons learned. You should be able to, have someone that can talk to America, tell them everything about it, and then say, go see your doctor. Any drug that you see a commercial for or whatever, it says at the end, talk to your doctor. We eliminated that. That is not a good path forward for us. We need to do better on collecting data so that doctors can be armed with what is actually happening. Adverse events. They happen with every vaccine, some more than others. You have to be prepared to discuss that and figure that out. So I know I went on and on. I'm sure I answered your question somewhere in there.
No,
I hope I
did.
did. So.
Yeah. We had Kellyanne Conway here earlier today, and she's sort of pushing Republicans to go more on offense on issues like IVF, healthcare, contraception. How do you think Republicans should counter the Democratic messaging on that?
Well, I think people just have to make up their own mind of where they stand on certain issues. I don't know that it's necessarily a Republican or Democrat issue. People have religious beliefs. Look, I'm a doctor, and I became a doctor because I have such a huge respect for human life, and I want to do everything I can. When it comes to abortion, for example, I'm pro-life. I make no apologies for that. But if you see the things I'm working on in Congress, it's to help pregnant mothers that may be in distress. We passed the McVie bill, which is maternal, infant, early childhood home visits. Tremendous results. So it may be someone who may be considering an alternative, but we get a nurse in their home. So I'm always working towards life issues in a way that can benefit anybody who's involved. So the messaging is, from me personally, is that I want to help any life, no matter how it comes about, but I have my own beliefs of how it should come about.
And Democrats are have an advantage in polling on abortion over Republicans. How do you feel like should Republicans change their tune to speak more about sort of what you were talking about there, and to try to change that?
Well, I'll tell you, I don't think most people at home are sitting around their dinner table with their kids every night talking about abortion. So I think in some places, you want to get into the politics, it seems like people are trying to make it a bigger issue than it is. But look, the Supreme Court had their ruling. States are going to decide really how it goes. That's how health has always been managed. Keep in mind that we were 13 basically individual countries that banded together to become one country. And I think it's a beautiful thing that we're the United States of America. So states are going to make up their own decisions on where they are, but things have definitely changed. Bill Clinton, when he was talked about abortion, he said, I think it should be legal but rare. Now I see people celebrating abortion. I have a hard time with that. I don't know that it should be actually celebrated because it's a very serious matter. But I understand where people, they have certain rights. Those are discussions we have to have, through our legislatures. But different states may disagree, and we do that often. And that's been the makeup of the United States of America.
Okay. Well, we're out of time. This has been a great conversation. Thanks so much for coming. And next we have our Robert King, our CMS reporter, coming up to moderate a panel.
Thank you all.